Hello, Professor. This is my health risk assessment self-evaluation. For part 1, health history. In my male family members, my father has a history of hypertension, and none of my grandfathers have any of the diseases listed. Neither do my uncles or my brothers. And in regards to my female family members, my mother has no significant medical history or any of the histories listed here or illnesses listed there. My grandmother does have a history of hypertension on my father's side, and neither does my aunt or my sisters. They don't have any of these illnesses or any of the other illnesses. I noticed that on my paternal side of my family, there is a history of hypertension as far back as my grandmother. On my maternal side, there is no history of any of the listed diseases or any other diseases. So this may put me at a higher risk for developing hypertension. For part 2, personal health profile, my current blood pressure is 124/82. I took that just now before I recorded this video. However, that is not my normal. I'm currently under some stress. My blood pressure would define me as pre-hypertensive, and this will most likely develop hypertension or into hypertension in the future if I'm not careful and manage it. And this would make sense considering my dad has hypertension. So question 1 says, do you see your healthcare provider every year for a checkup? I do. I just recently got health insurance after a couple years that I did not have it, so I was able to do my first primary care visit with my new PCP. Question 2 says, what is the date of your last checkup? My last checkup was November 20th. Question 3 says, did your healthcare provider have any concerns? They do not have any concerns. I don't have an extensive medical history and I've always been pretty healthy. For question 4, do you smoke? I said I do not. Question 5, if yes, how much? I said not applicable. Question 6 says, have you ever had a blood test? I have. And question 7 says, if yes, what was the date of the test? My blood test was November 20th. That was the same day that I saw my primary care provider. Question 8 says, have you ever been told that any of your blood values were outside of normal range? My blood results came back indicating that I had a vitamin D deficiency. Question 9 says, do you take any medications, supplements, or herbal products that may affect your nutritional status? Include any over-the-counter medications that you use even occasionally. I said I do not take any medication, supplements, or herbal products that may affect my nutrition and do not use over-the-counter drugs. For question 10, do you have any medical or physical conditions that require special attention regarding nutrition and or physical activity? I said I do not. And then for part 3, health habits and lifestyle assessment, under the exercise and fitness category, I scored a 0, which indicates a serious health risk in this area. Under nutrition score, I scored a 3, which indicates a moderate health risk in the area. For tobacco use, I scored a 10, which is excellent and means I'm aware of the importance of this area to my health and I'm putting my knowledge to work for me to practice good health habits. For alcohol and drugs, I scored a 10 as well, which means I'm aware of the importance of this area to my health and I'm putting my knowledge to work for me to practice good health. For the stress management score, I scored an 8, which is an excellent score and means I'm aware of the importance of this area to my health and I'm putting my knowledge to work for me. Under safety, I scored a 10, which means is excellent and means I'm aware of the importance of this area to my health and I'm putting my knowledge to work for me by practicing good health habits. For disease prevention, I scored a 9, which is excellent and means I'm aware of the importance of this area to my health and I'm putting my knowledge to work for me by practicing good health habits. For part 4, assessment of overall health and health risk, question 1 says, what do you think about the results? Honestly, I was very surprised. It was eye-catching for me. I know I mostly live a sedentary lifestyle, but never did I think it placed me at a serious health risk. And by the same vein, never did I think my nutritional choices would put me at a moderate health risk. I need to make changes in my life if I want to age gracefully. Question 2 says, with the information that you know about your health history and current health status, what preventative measures are needed to improve your longevity and quality of life? Because I have a family history of hypertension and elevated blood pressure, which is elevated blood pressure, I need to focus on preventative measures now. According to the CDC's preventing health or high blood pressure page. Physical activity can help keep you at a healthy weight and lower your blood pressure, and recommends that adults get at least 30 minutes of moderate exercise a day, 5 days a week. Although it would be difficult for someone like me, I need to make some changes now, so I do wish to incorporate at least 30 minutes of moderate exercise. Nutrition is also another preventative measure I need to take to improve my longevity and quality of life, given that my nutrition score was also very low. According to the Office on Women's Health, Healthy Eating in Women guidelines, a healthy eating pattern includes a variety of fruits and vegetables, whole grains, lean proteins, and low-fat dairy, while limiting sodium, added sugars, and unhealthy fats. So I'm going to incorporate more vegetables in my diet and try to include at least half of my plate with them for every meal to start, or at least half of it being fruits or a combination of both. Lastly, I eat a large amount of sodium in my diet, and according to the AHA's Lower Your Sodium and Blood Pressure Will Follow article, we should limit sodium intake because it can cause the body to retain fluid, which raises blood pressure. Therefore, I need to reduce my sodium intake and reduce the amount of processed foods that I eat so that my daily sodium consumption stays below the recommended daily limit of 1,500 milligrams set by the AHA, and probably even lower than that. Question 3 says, even if your current health status is excellent and you have little or no risk based on health history, what steps you need to take to maintain excellent health? Even though I do not have any major health problems right now, I need to stay productive. According to the CDC's Preventing High Blood Pressure article, regular blood pressure checks, physical activity, and healthy eating can help detect problems early and prevent chronic disease. So I should continue getting annual checkups, stay physically active, or begin to be physically active, and follow a balanced diet, which I've demarcated in question 2 of what I intend to do. And then question 4 says, why is it important to take these steps? I personally think these steps are important because high blood pressure often has no symptoms. And according to the CDC's Preventing High Blood Pressure article, uncontrolled high blood pressure can damage the heart, brain, and kidneys and lead to heart attacks and strokes. So by taking these actions now, I can reduce my risk of developing heart disease and protect my long-term health. And then earlier in this question, I did say that high blood pressure has no symptoms. That is not true. There are symptoms of high blood pressure. What I meant to say is that often it's gradual.